New tonight, San Francisco becoming the first major American city to require proof of full vaccinations for some indoor activities. Mayor London Breed is saying that as of August 20th, anyone 12 or older has to show proof to enter places, including an indoor restaurant, a gym, or a theater. This, as the city's sheriff's department warns there will be a wave of resignations if San Francisco's vaccine mandate for its employees is enforced. So out front now, Ken Lamba. He is the president of the Deputy Sheriff's Association for San Francisco. And Ken, I really appreciate your time. So this goes to the heart of it. It's your police department. It's others as well. I know you've been hearing about this directly from your members. According to a Facebook post, 160 deputies, which is about 23% of the force there, of the deputies, are not vaccinated. What are you doing to talk them out of potentially resigning? One, and two, what are you doing to encourage them to get the vaccine?
Oh, hi, Aaron. Thank you for allowing us to be on the show. We're definitely working on it. You know, the city is putting out a very robust educational program for COVID-19 vaccines, as well as the sheriff's department. And recently, they even started a hotline, for our deputies, police, fire, nurses, other employees to call in, to answer questions and help them with their concerns with the vaccines. And I do want to let you know some good news. Our vaccine rate is going up. The majority, of our deputies are vaccinated, and it's increasing. So, and we are encouraging that. We encourage that obviously verbally and, also with our communication methods with our members, with our email newsletters and so forth.
So, I know that there is a possibility of testing, and I know that there's some deputies who say, okay, well, I'm not going to get vaccinated, but I'll get tested regularly. Of course, we all know that that's not foolproof. You can, depending on how often you're testing, you don't always know when someone has it. Of course, testing also, doing it every single day and a PCR, can be very expensive. What are you doing about that? About having them understand that testing is not the first thing, right? The first thing is a vaccine that they should be looking at.
Well, the deputy sheriffs actually practice a very high standard of COVID-19 safety measures, along with wearing the mask. And I understand your position, what you're stating on the testing as well. But we do know testing does work. There are some failure rates with it, but the majority of it, it is a working system. They do wear masks. We have, hand sanitizers throughout our facilities. We provide them gloves. They do stay at a distance. Right. So they're practicing all the safety measures, as well. We are, and just to let you know, we are advocating. Go ahead. We are advocating.
No, I know you made it clear. You're advocating for the vaccine. I understand that. But who pays for the testing, though?
Well, it could be a variety of sources. Right now, the city is, but even outside of that, there are a lot of locations that do, provide testing. You have private companies. So there's a lot of resources out there. Matter of fact, I'm not sure if you're aware of this or if you heard of a company called Tiger Tech, where they have a electronic device that is FDA approved and does do the COVID testing as well.
Yeah, absolutely. So I wanted to, there's on the San Francisco Sheriff's website, there's a photo of with the caption, "Sheriff's deputies are getting vaccinated to protect themselves, their loved ones, and the people they protect and serve." And a captain who survived COVID also posted this message.
I feel much better after getting the vaccination. I'm very happy that I got vaccinated. There really are no excuses. Please get vaccinated and protect yourself and others around you.
How effective is that?
I think it's very effective. I do know that captain. He is a friend of mine. We communicate often. I think that's a very, effective message. But, also we do have, a group of members that are concerned about the vaccines too. They're concerned about the side effects. They would like to wait for FDA approved vaccines. And matter of fact, some of them would even like to wait for some of the newer vaccines that are coming out that are more effective. So I think our vaccination rate is going to increase. I just hope we have the opportunity to take advantage of the newer vaccines, the FDA-approved vaccines, and we want to avoid termination. Right now with the mandates, the city is the only other option is vaccinate or terminate. It's a very strong and extreme position. And we're low staffed. The police department's low staffed. Nurses are low staffed. Other city departments are low staffed. And if they're going to be terminating employees, we're going to get into an emergency staffing crisis in San Francisco. And that's really going to affect public safety. And not only, and I'm not, human life is priceless. And it's really unfortunate the amount of deaths with COVID-19. And in San Francisco this year, there's approximately about 130 deaths. But I'd like you also compare that to the drug overdose deaths. There are about 50 a month, and we're actually approaching 700 drug overdose deaths this year. So in comparison, I mean, COVID-19 in San Francisco is an emergency. The city is mandating some very extreme mandates, but on a parallel level of an emergency are the drug overdose deaths. And I don't see that attention there where it's really needed as well.
All right. Well, Ken, I appreciate your time. Thank you very much. And thank you for raising that as well.